Go.
Growing up, Norma and Lucy were best friends. As they both aged, Norma was always in great health with normal iron levels and oxygen levels and her body in complete homeostasis, while Lucy struggled with a complicated health history. Lucy's mother was diagnosed with systemic lupus erythematosus at 25, and Lucy is hoping it's not genetic. Her favorite place to hang out is the tanning salon, which is possibly an environmental risk factor to lupus. Now in her 20s, she's begun to feel very different, expressing many symptoms such as fever, hair loss, a butterfly rash, pericarditis, inflamed blood vessels, decreased iron, overall inflammation, rheumatoid arthritis, deposits, skin lesions, and osteoporosis. After speaking with her doctor, she was diagnosed with systemic lupus erythematosus. And doing some research, she wants to understand what's the difference between her body and Norma's. Systemic lupus erythematosus is a chronic inflammatory disease that can have an impact on any organ system. Looking closer into the immunity, we first notice the difference in the activity of the B cell. We can see that in Lucy's body, her B cells are hyperactive, producing an excessive amount of antibodies. With Norma, her B cells produce only the amount of antibodies required to combat foreign pathogens that enter her body. Lucy's B cells with lupus are not only attacking foreign pathogens, but they're also attacking the self-antigens, and this is a trademark of an autoimmune disorder. Normal antibodies will only attach to a foreign pathogen such as bacteria, and using the classical pathway. It creates a membrane attack complex which causes the lysis of the bacteria. It binds to the cell membrane of the bacteria and causes cell death. Inflammation is a large component to lupus, and although inflammation is caused by many things, the most prominent cause is due to anti-DNA antibodies breaking down the cells, which cause deposits on the connective tissue anywhere in the body, which is why this disease is systemic. Deposits alone cause inflammation, but deposits also activate the complement system, which also in turn results in more inflammation. In a normal functioning body, when an injury or pathogen enters, inflammation is a normal process that is temporary, which produces redness, heat, swelling, and pain, at least until the macrophages are able to clean up the debris from the tissue. The inflammation with lupus is not temporary and incorporates the fifth cardinal sign of inflammation, impaired function. One of the complications of inflammation is swollen and inflamed blood vessels. In Norma's body, blood supplies the organ and tissues with the adequate oxygen needed to perform the daily functions. In Lucy's body, due to the swollen and inflamed blood vessels, oxygen is decreased, which impairs blood supply to the tissues, and this leads to further inflammation and tissue destruction. Focusing now on sex hormones, we take a look to Norma's body and notice a homeostatic balance between estrogen, androgen, LH, and FSH. However, looking at Lucy's, we notice an imbalance, especially in estrogen, which disrupts that homeostatic balance. The imbalance increases helper T cell function, which causes the release of interleukin-10 and interferon alpha. These cytokines increase B cell function, which leads to more autoimmune antibodies. These cytokines also inhibit macrophage and dendritic cell function. The imbalance of sex hormones in Lucy's body decrease the T regulator cells, which is necessary to turn off the helper T cells. Looking into genetics HLA-DR and HLA-DQ are both genes that are thought to cause lupus. They both have the MHC class II protein, while in Norma's body, the MHC proteins are required for T cells to recognize an antigen. MHC class II proteins are found on the cell membrane of dendritic cells, macrophages, and B cells. And this concludes our overall view of systemic lupus erythematosus.
In summary, systemic lupus erythematosus affects the key concept of homeostasis by disrupting the immune system. This is an autoimmune disease where the immune system has trouble distinguishing self cells from foreign cells. Homeostasis is also disrupted with the imbalance of the sex hormones. Two examples of the key concept of proteins are the anti-DNA antibodies and cytokines. Anti-DNA antibodies cause inflammation when they leave deposits on the connective tissues, which can be any connective tissue in the body. Blood vessels too can become inflamed, which leads to poor oxygen through these blood vessels, which eventually leads to tissue death. Cytokines are proteins in lupus. Interleukin 10 and interferon alpha are both involved in this disease. In the cell membrane, the MHC class II molecule is present in the two genes thought to contribute to lupus, the HLA-DR and DQ. The cell membrane is also involved in this disease when the complement system is activated. Mostly it is activated when there are deposits left on the connective tissue by anti-DNA antibodies. The end.